Have you ever had a patient that was bleeding faster than you could replace it and you just ran out of time before you could get them to definitive care in the OR and they died en route? Yeah, me too. Well, here comes my friend Jonathan. He's got something that might change the game for us in junctional abdominal bleeding.
Hi guys, I'm Jonathan. I work for Compression Works. This is the AAJT-S. That stands for Abdominal Aortic Junctional Tourniquet. So we got a bladder on the back that gets inflated to 250 millimeters of mercury and can compress the abdominal aorta as well as the junctional spaces. So I'm gonna put it on Nurse Winnie here and just show you a little bit how it works. We're gonna get that bladder positioned directly over her umbilicus and get this tightened down. We do red to red. We're gonna remove all of the slack out of the rest of the device. We're gonna give it just a couple ratchets this way. Make sure this is centered right on her umbilicus. And then we're gonna tighten this down and we're gonna go until we see green here on the pressure manometer. So you guys that work in the flight world, this also has a pressure relief valve, so you can't overinflate it if you have to go to up to higher altitude, so at 300. I'm not gonna inflate this on you all the way.
I'm flexing my abs, is that gonna help?
Yeah.
I hope I don't fart.
So you can see there's a bag being inflated here, and so what this does, this gives patients a big spike in systolic blood pressure. It obviously cuts off the lower half of the body, so any bleeding into the pelvis. So I'm sure you guys have probably had like postpartum hemorrhage patients, open book pelvic fractures, things like that. Our device has been around for quite a few years in the military space, making its way stateside with a lot of different agencies, and it's really changing the game in the way we manage those pelvic fracture patients. We all know if we can stop the bleeding and then resuscitate, we have a lot better chance of getting that patient into the ER.
Jonathan, this kind of reminds me of, can we let down the pressure so I can talk? It reminds me of REBOA, which is resuscitative, meaning this is a last-ditch effort and just buying us time. Endovascular, so inside the vasculature. Balloon occlusion of the aorta. Remember like in episodes of MASH that your grandparents used to watch and they'd be like, clamp the aorta. Well, that's essentially what we're doing, is we stop perfusion distal to the point of wherever that injury is. These patients are bleeding out. But here in America, we're not doing REBOA pre-hospital. But you guys have created something that's kind of a REBOA surrogate.
Yeah, absolutely. And so we have, if you look at the studies, and we have a document that has over 70 peer-reviewed independent studies over the years, so very researched. If you look at the studies and the pressures that we're creating, it's very comparable to REBOA, almost exactly. And so we're still getting 100% occlusion of the abdominal aorta. We're also getting occlusion of the IVC as well. So any sort of like backflowing blood from the right side of the heart that might be an issue, we can stop that as well. So patients really get the benefit of having that increased intra-abdominal pressure and the reduction of blood flow so that they can be resuscitated and make it to the ER.
Excellent. Well, thank you for showing this really cool device. And if you guys are interested, they distribute through Boundtree, which I'm sure we're all familiar with, or you said North American Rescue as well, right?
Yeah.
Okay, well there you have it. What's it called?
The AAJT-S.
That was really good.